Okay, so for another thing that could actually capture our attention when we are doing physical examination for gynecology is if a woman is having a thyroid gland and the thyroid gland is big, is enlarged. Okay, so you can pick this up on physical examination. The patient could actually complain to you about this. Okay, so we're now trying to look at what does it actually mean and what are the possible complications that could come up from a thyroid gland that is as large as this. So thyroid enlargement, or goiter as people popularly call it, is an important finding during general physical examination in obstetrics and gynecology, though not directly part of the reproductive system. The thyroid dysfunction can affect the reproductive system. Do you understand? So it can affect how the woman's menstrual cycle is going, can affect her fertility, it can affect the possibility of this woman having abortions and all. So why are you checking the thyroid? You don't just check the thyroid in every thing. Probably you have dictated or the woman has complained about irregular menstrual flows, so check out for the thyroid. If she has complained about not being able to take in, she has complained about being weak, she's just gaining weight, become plumpy and all of that, maybe she's depressed. So let's look at this now. Thyroid gland being enlarged could come up with two complications. It could come up with the thyroid being hyperactive, or it could come up with the thyroid being low in activity. Okay, so hyperthyroidism can lead to what? Amenorrhea. She's not bleeding at all, or her menstruation is just very light. It can lead to miscarriages, can lead to her heart beating anyhow. Thyroid enlargement may indicate that maybe there's iodine deficiency, autoimmune conditions, or thyroid nodules or cancer. But this is how they could actually affect the reproductive system. Now, okay, you should know that there's hypothyroidism, right? But hypothyroidism is not really a thing in gynecology. Do you understand? So how to examine the thyroid? Ask the patient to sit upright with the neck slightly extended. Okay, ensure good lighting so that I can see very well. Okay, so you can feel it like this. So you inspect where you are looking at if there's a visible swelling in the anterior neck. You can also ask the patient to swallow water so that you observe the movement. Then you palpate just like this. Okay, shake it. Okay, so palpate each lobe for if they are actually the size is the same with this side. Okay, consistency, is it smooth, is it soft? Okay, can it move freely? Do you understand? So red flags, if you see that there's a diffuse enlargement just like this, okay, nodules or tenderness or hoarseness of voice, or she's having difficulties in swallowing the water that we asked her to swallow. Do you understand? That's where you now start picking and relating the issues she has with the thyroid with the issues she's having in the reproductive system.